It's time now to Ask the Expert, and here to answer your questions about acne is dermatologist Dr. James Pehoushek. All right, our first question coming from Amy in Phoenix. I'm in my 40s and I am still breaking out. What should I do?
Well, Amy, first off, depending on how bad your acne is, if it's really driving you crazy, call your dermatologist or find a dermatologist who will see you and come on in. But in the meantime, if you haven't tried it already, I recommend some of the simple over-the-counter things. Benzoyl peroxide works well. There's also some salicylic acid products. And then over-the-counter retinoids like Differin, which is adapalene, that can work pretty well.
Okay, all right. And I know that's hard because, again, it's hormones.
Yeah.
So.
And the other thing I tell people is stick with something for at least 2 months before you give up on it. Yeah, because there's no
overnight.
Yeah, bring magical.
Okay, all right, 2 months, wow. All right, Jana from Scottsdale says, I see a lot of products at the pharmacy. Did they help? Is one better than the other?
And again, this is going back to what I was saying before. There's a few products, there's a lot of products, but they all have basically the same active ingredients in it. If you look, it's benzoyl peroxide, salicylic acid, and then some with retinoids. So find the one that you find the most agreeable or cosmetically elegant, as they say, and use that one regularly. Cleanse your face with gentle cleansers, moisturizers if you need it, and just stick to it.
Yeah, as hard as it is, stay with it for at least 2 months. And if it doesn't work out, then what?
Call me.
Okay, I'll call. Call your dermatologist. Layla from Mesa says, is it true that diet and sugar can cause acne?
Well, as we were talking about earlier, yes, sugar can be a factor. And so, you know, if you're going to try something, it's not going to be bad for you anyhow to cut back on your sugar intake, and, you know, it'll probably help some other things too. So that's definitely something worth trying, and it might make a difference for you. And if you notice it's making a difference, then all right, stick to it.
Yeah, stick to it. All right. Tom from Chandler says, does sweat cause acne? That's a good question.
Right, and you know, it's come up. There've been a few studies. There's nothing conclusive, but there is some data that shows that it might make a difference, mostly because sweat can cause a little bit of puffiness in your skin and kink off some of the sweat glands. But again, most people, sweat is a very benign natural substance that your body makes. It doesn't contain bacteria or anything evil. So it's there for a reason, and you know, it's almost impossible to avoid too.
Yeah,
so
yeah.
What are you going to do about it?
Yeah, I was going to
say. But the bullet point is no.
Okay.
I wouldn't make a big deal.
Okay, good to know. Good to know. Dara from Avondale says, does stress cause acne?
Right.
I feel like you would think yes, but I mean, does it?
Well, again, great question, and I get this one a lot. I got stress acne. Well, in a way, it does. Stress can, in a lot of ways, give you anxiety. And anxiety, you tend to mess with things. And so people tend to pick at their acne lesions or pick at little spots. And so that can actually make acne worse and cause more irritation and cause scarring. There's also release of stress hormones, which can actually stimulate more acne. So the short answer is it can make it a little bit worse, but it's not the main cause.
Okay.